Animal Eye Special Clinic. This is Mark speaking. How can I help you? Hi, Digger. How are you? What's going on today? So you're not able to see? Well, that's not good. Well, do you think this is something that you need to come in today, or do you want to be seen on an emergency, or do you want to schedule it for tomorrow? For tomorrow? Well, we can take care of that for you. Just so you know, if you feel you want to come in this evening, we can get you taken care of. We're always here for you. How about 11 o'clock tomorrow? Alrighty, well, we'll see you tomorrow at 11, Digger. Thanks, bye. Well, hello, welcome to the Animal Eye Special Clinic. You must be Digger. Hi. Do you want me to come out and help you get into the exam room? Alright, I'm going to come around and help you. Alright, Digger, I'm going to get Dr. Bus for you, okay? 1 second, I'll be right back. Dr. Bus, we're ready for you.
Hey, Digger. How you doing today? I heard you were having a hard time seeing a little bit, huh? You think we can have a look at you and figure out what's going on? Perfect. Well, why don't you come over here, and we're going to do a few tests and then have a look, okay?
Alright, Digger, you stand right here.
I'm going to take your glasses off, Digger, because we need to be able to see those beautiful eyes, okay? So normally what we would do is we would do a stain test first. And the stain test, stain test, and it was orange. It turns your eyes orange, yeah. And then what happens is we shine a fancy blue light on using this thing. It's called a slit lamp, and this is one of the special devices that we get to use. Human ophthalmologists use things like this too. And basically with the blue light, see how it's kind of blue on my hand? Everybody can kind of see that with the special blue light. If I turn the light off, you can even see it better. What that does is it's going to glow green on your eyes if you have an ulcer. So we do that test first. And then what we do is a tear test, because we need to make sure you're tearing properly. And then so we put these little strips right in your eye. You don't really feel it, and it's just to make sure you've got normal tears. And after that, we use this special device, and I can show it to you. It's nothing to be afraid of. I know that some dogs get kind of scared of it because it looks kind of funny. But what it is, it's a device where I get to measure the pressure inside your eye. And all I simply do is I put a numbing drop in both eyes so you don't feel it. And then I simply take this little device and I go like this. Tiny little taps. You don't even feel it. Tiny little taps. And I get to measure the pressure inside your eye. And those are all the the pre-screening tests that we would do just to make sure that everything's kind of okay at the beginning, alright? And then the fun stuff starts. After that, we use this fun device again. Again, this whole thing is designed to magnify everything that I can see there super close so that I can figure out what's going on. Do you want me to look at your eyes with that? That, then we put this funny device on my head, and this is even funnier. I know some dogs kind of get scared, but don't be scared. It's nothing to be afraid of. I know, it's funny, isn't it? Yeah, a light comes from my forehead. It's pretty funny. And then see this thing? This is a lens, and what I get to do is I can look way in the back of your eye at the retina, which is where the light sensing tissue is. And this is what your human doctor would do as well. And what I'm looking for is any kind of evidence of disease at the back of the eye. And once we've done those tests, we can determine what's going on, if there's anything going on at all. Alright? Sound okay? Perfect. Do you want to see the rest of the hospital? Alright, let's take you on a tour. Alright, Digger, if there was something that was wrong with you, and thankfully there isn't anything major, but this is our operating theater, and our operating theater has lots of different things in it. So in veterinary ophthalmology, we can do almost everything the same that we can in human ophthalmology. So let me just show you. Come on in. The funnest thing in the room, I think, is the operating microscope, and this allows us to zoom way down low on the eye to make sure that we're zoomed right in so we can do that finite little surgery. Lots of different types of surgeries we use to use this. We sometimes will do corneal transplants or grafting procedures, or one of the funnest procedures we get to do is cataract surgery. So dogs get cataracts just the same as people, and we can do cataract surgery to remove the cataract and give them their vision back. So it's super fun in here, Digger. We've got a laser machine. We've got a machine that we use for freezing certain things off of eyes if there's growths that occur on dogs like they do. This is our cataract machine like we spoke about, and then there's all the surgical instruments that we need to use, and then all the special monitoring equipment on this table here, just to make sure that all of our patients are super well controlled under anesthesia, and so we don't have any problems. So very, very similar to a human operating theater. Digger, this is the diagnostic room, and so this is a room that we use when we're trying to test a dog who might have cataract surgery. And so the first thing we might do is do an ultrasound of the eye. And so, yeah, look at this. It's not anything scary. It won't hurt at all. And so what we're looking at doing is, because I can't see through a dog's cataract to the back of the eye where the light sensing tissue is, what we do is we put a numbing drop on the eye again so you don't feel a thing. And then I just go like this. I'll show you, trust me. And so I'm just going to put the probe on your eye and I scan around, and what I'm doing is I'm looking to make sure your retina looks healthy. And if that's healthy, that's a good thing. That means we might be able to do cataract surgery. Yeah! And then guess what? You get to see again. And that's a lot of fun if you've got cataracts. The other thing we might do is on this machine, and I'm not going to do it to you because it's not something we want to do right now, but it's a test that doesn't hurt as well. And we put this fancy contact lens on your eye and it's hooked to this computer. Yep. And we punch your name in there, and we flash lights at your eyeball, and every single time your eyeball sees the light, we get a blip on the screen like a heartbeat, and if that blip shows you got good retinal function, guess what? High five to cataract surgery. Alright, Digger, well, in our tests we did find that you had low tears, and that's why your vision was so cloudy. So guess what? Super easy treatment. We're going to send you home with some eye drops that are going to make you develop more tears, and then your vision's going to clear up, so you don't need your eyeglasses anymore. Alright, Digger, thanks again for coming in. And what we need to do is we need to see you in about a month just to make sure your tears are better, okay? And if everything's good at that point in time, it's just a yearly exam. Once a year we want to see you just to make sure your eyes stay nice and clear. All right? Thanks, Digger. We'll see you again. Thank you very much. Bye now. We at Animal Eye Specialty Clinic are proud to be back as sponsors for Walk for the Animals occurring March 3rd, 2018.